This is about the sternoclavicular joint. It is very important joint in the shoulder complex. So here the sternoclavicular joint, it is going to connect the entire upper limb to the axial skeleton. This point anyway we saw in recent classes. Okay, now we'll see sternoclavicular joint is a synovial joint. In the synovial, it is a plain synovial joint. So that this joint is having 3 degree of freedom. What is this 3 degree of freedom means? Suppose, just example, see, suppose if you take shoulder joint, here we will be having flexion extension movement, abduction and adduction movement, and medial rotation and lateral rotation movements. Total 6 movements are there. Flexion extension will happen in which plane? Sagittal plane, and abduction adduction will happen in the frontal plane. Medial lateral rotation will happen in the transverse plane. So transverse plane, what is the axis? Vertical axis. Frontal plane, what is the axis? Sagittal axis. Sagittal plane, what is the axis? Frontal axis. So we will understand what is this 3 degree of freedom means. Suppose if we take any plane or any axis, we will be getting 2 movements. If we take sagittal plane or frontal axis, flexion extension, 2 movements will be there. So if you take abduction adduction in frontal plane or sagittal axis, 2 movements. So whatever the axis are plane, if you take one axis, it will be having 2 planes. At the same time, if you take one plane, any plane, it will be having 2 planes. So that here we will say that shoulder joint is a 3 degree of freedom. It is a triaxial joint, not triaxial joint. Shoulder joint is a triaxial joint. That means tri means 3, axial means 3 axis. Triaxial means 3 axis is equal to 6 movements, because one axis will be having 2 movements. So that here the point is 3 degree of freedom means the joint will be having 6 movements. Okay. Here, suppose if the sternoclavicular joint is moving, automatically it is going to move the scapula. Automatically it is going to move the scapula. That means scapulothoracic joint, because we know the connection. Scapula is going to connect to the acromioclavicular joint and sternoclavicular joint. So that sternoclavicular joint movements are going to create the movement at the scapula. At the same time, scapula movements are going to create the movements at the sternoclavicular joint. Because it is a synovial joint, so here it is a synovial, plain synovial joint. Because of it is synovial joint, this joint, sternoclavicular joint, will be having the joint capsule will be having, and one more here will be having 3 ligaments. 3 ligament support will be there. And at the same time, one joint disc will be there. So these are the 3 important features of the sternoclavicular joint when compared to scapulothoracic joint, because that is a false joint. There is not true anatomical joint, that is a functional joint. This is the anatomical joint, and that it is a synovial. Synovial means freely movable joint. 3 degree of freedom. Total 6 movements will be there. So it is a synovial joint. So in synovial joints we can see capsules, ligaments for static stability, and joint disc. It may vary from joint to joint. If you take suppose shoulder joint, will not have disc, even though it is a synovial joint. If you take TMJ, temporomandibular joint, it is having disc. It is also a synovial joint. Here this is also synovial joint. This joint also having disc. If we see articular surface of the sternoclavicular joint, here will be having 2 articular surfaces. First articular surface will be at the sternal end of clavicle. So this is the sternal end of the clavicle. Why that name sternal means it is going to connect to the sternum. So that way sternal end of the clavicle. Otherwise we can say like medial end. This is lateral end of the clavicle. And second one, manubrium. Okay, manubrium and the first costal cartilage. Manubrium and first costal cartilage. See, this is the manubrium. A notch will be on the manubrium, and it is going to form by the manubrium. And at the same time, this is the green color. It is the first costal cartilage. This is first rib. So the articular surface it is going to be created by the notch at the manubrium and first costal cartilage. So the articulation between these two structures is nothing but the sternoclavicular joint. And that if we observe, there is a little contact between the first and second articular surface. It is not complete contact. If you see a joint, if it is like this, so this is the complete contact. But here the contact is very less. In the sternoclavicular joint. This is one typical point we have to understand. See, the superior portion of the medial head of the clavicle. See, the superior portion of the medial head of the clavicle is not going to articulate with the manubrium. So see here it is clearly it is not going to articulate with the manubrium. Instead of manubrium, this superior portion of the medial end of the clavicle is going to articulate with the disc of the. So here this red color one disc, we'll see it later. Okay, it is going to articulate with the disc, and at the same time interclavicular ligament. What is this ligament? Here we have one clavicle. Same like this, here we will be having one more clavicle will be there. So the superior portions will be connected to the articular beam, disc and interclavicular ligament. Interclavicular ligament is nothing but the ligament which is present between the 2 clavicles. That is interclavicular ligament.